same time.
Could you say one more time what those were?
Capital extension and cervical extension.
Okay.
So she is prone, and when you're checking the extensions, you're going to ask your patient to slide off the table. Don't forget. Slide off the table so that their head is off the table, so you can see actually what they did. Okay. So I'm going to tell her what I want her to do before I have her go out off of the table, because then her head's just going to be hanging there and be uncomfortable. So Alice, whenever I tell you, you're going to slide forward, your head will be off of the table. And whenever I tell you, I want you to not lift your whole body, but I just want you to try to look at the window. Okay?
All right.
Here we go. All right, so go ahead and slide forward. So your head is off the table. Come on. Looking very good. All right, so without lifting your whole body, can you just lift the top of your head so you can look out the window? Oh, good. Right there. Did she do it?
Yes.
Is she a 3?
Yes.
Is she, relax, is she a 4?
Possible.
Is she a 5? Should I go ahead and push on it?
No.
Okay, I would fail. Now you're going to do the same thing, but really struggle for me. Okay, she's lifting. I told her, oh, look at that. Okay, good, rest. That looked like it was a lot of work. What grade would she be? Okay, I'll just trace. I did it. Yeah, very good. Maybe make a nice grunty noise so your therapist knows you did it. Oh, good. That was very good acting. And that was a 1. I see that she was trying to do something. She didn't really move anywhere, but I saw a little quivering, a little working. You guys can work on your acting skills. I'm not touching her. I didn't mean to touch her. Right? You're not doing any touching right now. You are observing. Look how easy that is. Okay? And then a 0 would be, try to do that, look out the window. All right? Yeah. Okay? So that's the capital extension. Cervical extension is all the same stuff. I'm still not touching her, but now I'm telling her, I want you to lift and really look up at that window. I mean, lift your whole neck. Ready, go. Oh, good. That was even some thoracic stuff. But, so go ahead, and I'm just going to, I want you to not move here, but lift your whole head and neck. Go ahead and look. Good. Look at that. And she is either 3, 4, or 5. Did she pass this test? She sure did. I'm done with that. Come on down. Same thing at 2, I'm going to ask her to do the same thing, but she's going to do partial range or struggle with it. Go ahead and try that. Oh boy, that's tough, she thinks. Okay, good, that's a 2. Same thing, 1 is just a little trace, 0, you don't know if she heard you. All right? So those are those. Flip over onto your back. Scooch down so your head is on the table. As a general rule, if I had an option, I always, for patient positioning, would like to have a bolster or pillow under her knees to take pressure off of the lumbar spine. Clinically, that is always the right choice if it's an option. Here, especially for the trunk things, we've said it's okay for the legs to be straight, but at some point in your schooling career, I will be mad at you if you work on your patient like this. Okay? But for here, it's okay for now. All right, so for the cervical things, how much work am I going to do?
0.
This much work. All right. So, thank you. So, same things exactly like we just did for this capital and cervical extension. Now it's just flexion. So here, I would say for the capital flexion, this is just the nod. I might ask my patient, can you just bring your chin to your chest like you're trying to give yourself a double chin? Woo! Good. Done. 3, 4, 5. Yeah? A 2 would be a low struggle. Okay, good. And a 1 would be, maybe she did something, I don't know. 0, she just lies there. I don't touch. Good? Same exact thing goes for the cervical flexion. So I would say to my patient, I want you to lift your head off the table, bring your chin to your chest. And look at that. Good. 3, 4, or 5. 2 is partial. 1's trace. 0 is nothing. Questions about that?